CDC revised its recommendations for pediatric hepatitis B vaccinations, what's been in place since 1990, and reduced pediatric hepatitis by 99%, was that every child was given a hepatitis B vaccine in the first 24 hours of life, irregardless of the mother's hepatitis status. That's been changed to first dose being given at approximately 2 months. It might not seem like a big difference, but it is. A lot of children now are going to be unnecessarily exposed to this potentially life-threatening viral illness. In 1990, 20,000 children a year became hepatitis B positive. That's become negligible. And a child who develops hepatitis B has a 90% chance of going into chronic hepatitis, and about 25% of those are going to develop either cirrhosis of the liver or a primary hepatoma, in other words, a cancer of the liver. And the CDC should have taken more time into explaining how hepatitis B is contracted, because most people are under the impression that there's only 2 ways: unprotected sex with somebody who's hepatitis B positive, or the sharing of needles in IV drug abusers. Well, that might be 2 very common methods in an adult population. However, spread in children is different. That's usually blood-borne. The hepatitis B virus could last on the surface for just over a week. So if a drop of contaminated blood gets on a toy or in food or on a child's desktop, and they manage to either get it in a cut or get it into their mouth, then they can become contaminated with hepatitis B. Now, they wanted to make it more like the Denmark system, where nobody gets a hepatitis B vaccination unless you have a specific indication, such as a hepatitis B positive mother. However, you can't compare the United States to Denmark. Their system won't work here. First of all, they have 6 million people. We have 315 million people. They have universal health care. We have a fragmented system of health care. Now, it wouldn't work in our country. We're too diverse, and we have too many people that will fall through the cracks. And the fact that parents are going to be afraid now means that many children are not going to get that vaccine in 2 months. And they're going to go unprotected unnecessarily. And that's going to cause a resurgence of this disease, and unfortunately, an early demise for some.